Hi, I'm Ammar Khalid, a policy associate at the Urban Institute's Justice Policy Center. In this video, I will talk about an assessment our team recently published with funding from the Department of Justice's Bureau of Justice Assistance on how some states have used the Justice Reinvestment Initiative, or JRI, process to strengthen community-based service capacity and improve public safety. First, let me explain what the JRI process is. JRI is a process that uses criminal justice data to design and implement innovative, research-backed, and comprehensive approaches to reduce crime, cut recidivism rates, and shift resources towards more effective public safety strategies. Out of the 36 states that have engaged in the JRI process thus far, a subset have also made investments to improve community-based capacity to advance prevention and treatment efforts outside of criminal legal system agencies. They've often done this as part of a holistic approach that recognizes local organizations and service providers as essential partners in addressing safety challenges and reducing overall justice system involvement. This video is based on a recently released brief in which our team highlighted 10 JRI states' capacity building strategies to provide and enhance services related to safety and well-being that 1. Are available in the community, and 2. Operate independently from criminal legal system agencies. In each of the 10 states, which are Alaska, Louisiana, Maryland, Massachusetts, Missouri, Nebraska, North Dakota, Oregon, South Dakota, and Utah, our team conducted document reviews and semi-structured interviews with key stakeholders. So, what did we find about these states' JRI-based efforts to improve community capacity for service provision? First, let's talk about the different kinds of partnerships and participation these efforts fostered. Multiple stakeholders mentioned that creating and strengthening connections with community-based stakeholders early on in the JRI process, especially by having diverse representation on state JRI working groups, which are set up early in the JRI process, can help shape a state's overall JRI goals. For example, Oregon's JRI working group included members of federally recognized tribes, while Utah's featured representatives from community-based behavioral health service providers. In many states, JRI efforts to strengthen community-based capacity also fostered interagency collaborations, such as those between departments of corrections and behavioral health agencies. Next, we observed that states used a host of strategies to strengthen community-based service capacity. Some focused their community-based capacity building efforts on multiple service areas, while others focused on a specific type of community need. For instance, Maryland's JRI Community Reinvestment Grants aim to serve people who had experienced victimization, divert people from the criminal legal system, and reduce recidivism. And Nebraska used JRI funds to boost community capacity specifically for housing provision. Multiple states such as North Dakota and Missouri also provided specialized peer support services through programs established using the JRI process. Other states prioritized certain geographies for service provision. South Dakota, for instance, targeted rural areas to increase access to behavioral health care. To strengthen community-based service capacity, states use many different investment mechanisms through their JRI processes. First, whereas most states invested JRI funds upfront in their reform processes, others, like Maryland, waited for JRI savings or averted costs to accrue first. Second, some states, like Louisiana, implemented grant programs to support community-based providers, whereas others use cost reimbursement mechanisms and performance incentive payments. Third, some states, like Utah, leveraged existing relationships and provider networks to award grants to community partners, whereas others, such as Alaska, issued competitive requests for proposals. Next, states used a variety of strategies to expand and adapt investment resources and approaches toward JRI-related community capacity building goals. Some states, like South Dakota, piloted new approaches that provided helpful learning and feedback that informed full implementation. Others, like Oregon, conducted reviews and evaluations during implementation to assess efficacy. In terms of growing and sustaining their JRI community capacity building, states adopted different approaches. Alaska leveraged its state cannabis tax revenue and federal grants to increase service capacity, whereas Nebraska used a JRI maximizing grant to supplement its earlier JRI investments in housing supports. JRI maximizing grants are grants that are typically focused on specific initiatives and are competitively awarded by BJA to strengthen states' JRI reform efforts. And some states also leverage the JRI-related capacity building work to understand and meet additional service needs. Louisiana, in response to housing needs identified by many of its JRI community-based grantees, set up a transitional housing program. South Dakota, after engaging in JRI, took on a juvenile Justice Reinvestment Initiative that included a similar approach to expand behavioral health treatment for youth in the state's rural areas. Lastly, there are some key takeaways for other states to consider. First, there is a robust body of literature on the public safety benefits of strong community service infrastructure, including evidence of a direct association with reduced violent and property crime rates. Simply put, strategies that help communities meet their own basic needs can have wide-ranging benefits for public safety and well-being. Next, partnerships across state and local government agencies and community-based providers are key for community capacity building efforts. It is crucial that these partnerships involve strong and ongoing communication. This can be done by establishing communication channels between partners early and maintaining transparency throughout the policy development and implementation processes. Additionally, collaboration between government agencies and community organizations can be mutually beneficial but requires intentional efforts, including building trust and establishing clear roles and responsibilities. Lastly, community and government partnerships that build on existing grantee networks can enable new initiatives to launch quickly, while partnerships built on new connections, especially those with hyperlocal organizations such as faith-based institutions, could help leverage critical existing relationships and connections to clients. There are several key takeaways for funding processes and goals for strengthening community service provision capacity. For one, investing in data capacity and grant-making infrastructure is crucial. Also, providing peer re-entry support services can be challenging and resource-intensive, yet this is a critical component of comprehensive public safety strategies. So if you want to learn more about states' efforts to build community-based service provision capacity through the JRI process, use the link to access our full report. Thank you for your interest in learning about how the JRI process can be used to improve community-based service capacity to improve overall public safety.